All right, so a lot of women give birth in a hospital setting and they're completely unaware that they're going to be given Pitocin at some point during their labor and delivery, and they're unaware of the true need for that, whether or not there is a true need, and also at times they're unaware of the risks. And so I want to talk a little bit about this because nearly every woman is given Pitocin during the third stage of labor, and that is that after the baby is born, there is an active management, there is control over the process and speed in which the placenta is delivered. And this is so important because what happens is that the woman is given the Pitocin and then a technique called controlled cord traction takes place. Controlled cord traction is where the provider will pull on the umbilical cord while pushing on the mom's abdomen. And this, again, it speeds up the delivery, and the hope is that it will prevent postpartum hemorrhage. However, cord traction can also contribute to the risk of postpartum hemorrhage. And so the technique that they're using to speed things up and hopefully prevent it can also cause it. So it's important to know that. But in addition to that, there are other risks as well. One of them, and this most significant risk, is something called uterine inversion. And that is where when they are pulling on the umbilical cord to get the woman to deliver it as quickly as possible in hopes of preventing postpartum hemorrhage, they run the risk of creating something called uterine inversion, and that is a life-threatening emergency where the placenta is still firmly attached to the uterine wall and the traction pulls the entire uterus inside out. And so that is a risk that women should know about. There's also cord avulsion, that is cord snapping, and so if they pull on the umbilical cord and it breaks, that means that the placenta is now stuck in the uterus without a tether. And so what needs to be done is a manual extraction, meaning that a provider needs to reach way up there and remove that manually, significantly increasing the risk of birth trauma. At that point, it's more or less inevitable, and also increases the risk of infection, and they also run the risk of leaving some parts behind, because if they pulled on the umbilical cord and it broke, there's also a chance that the placenta tore, and if there's retention of parts of the placenta, there is the risk of postpartum hemorrhage. And so this is important to know. The body does need time to naturally signal the placenta's release, and so when the body and the hormones within a woman's body are not given that time to signal its release, and then there's these interventions, there's this rush, there's this hurry, there's this assembly line in hopes of preventing postpartum hemorrhage. Not only can the risk of postpartum hemorrhage